Process efficiency is critical to improve the culture of an OR, which in the end improves the financial and operational performance. And we've talked about process efficiency, things like turnaround time, first case on time starts for decades, right? It's not necessarily a new concept, but it doesn't make it any less important in terms of how to drive a well-run surgical services. One of the greatest complaints that surgeons have, right, is long turnover times, the patient not being ready when they are. And it's hard to ask a surgeon to show up on time or to do more cases if he or she is still struggling with what's happening after close and before the next cut. And that's where administration and nursing and anesthesiology really need to come together and say, how do we sustain true operational efficiency, reduce turnover times, improve first case on time starts, make sure patients are prepped in a way that same day cancellations are controlled. We like those to be less than 1%. And it's costly. It's costly when those occur, or if there's inefficiencies in the system. So what we recommend is that one sets up a collaborative daily review where you're bringing all those stakeholders together to collaborate in how to turn over the rooms faster, how to make sure the surgeon or that the case starts on time. You know, there is a cascading set of events that need to happen about an hour before a case that nursing needs, the patient needs to do, the nursing needs to do, anesthesia needs to do before even the patient can get into the room. And so we need central sterile processing and transport, everyone together in this collaborative daily review to look at the patients that are going to be scheduled 24 hours out, 48 hours out, ideally up to 72 hours out. And that's when you know you really have a high functioning collaborative daily review. People think about that in terms of the daily huddle. This is something more sophisticated, a little bit more proactive and collaborative. It's also important as you think about this in terms of driving cultural change. So we have found across the 500 different hospitals that we've worked with, what is the easiest change to make? And I put easy in air quotes because nothing's particularly easy, but we have found that in terms of the change curve, that first case on time starts is something that warms people up to change. It may not have the hugest financial or operational impact to the OR, but it gets people thinking about how they can work together and collaborate to get to a positive outcome. And so as we think about the ability to change and drive impact, first case on time starts is one of those first things that can be done. Next, turnaround time. That's slightly more complicated, more constituents. You don't always know when it's going to happen because of varying case lengths. And so that's next on the curve. And then you can build up to prime time utilization and room utilization. But those sorts of efficiency improvements and metrics warm an organization up for change, which is what you need to really drive a cultural transformation.